Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. Yes. All right, we're live now, Doc. So we want to tell everybody that, of course, our conversation for this morning is going to be looking at what COVID-19 does to the body, understanding more about how people become carriers and how it spreads. And we have with us this morning internist and intensivist, Dr. Jorge Hidalgo. Good morning.
Good morning.
Good morning.
Good morning.
Thanks for having me.
How are you doing?
We're okay under the circumstances, but I'm happy that things seems to be okay, for the country.
Yeah. You were telling me that you were under isolation and you have one more week to go with no symptoms and negative tests?
That's right. I'm adhering to that, and no symptoms and testing negative, and we are okay.
Yeah. So, Dr. Hidalgo, when we look at the situation today, 1 week, no new cases. I described to Isani earlier, for me personally, I feel a nervous calm. It feels like a nervous calm because practically speaking, we are probably going to be seeing more cases. Is that the case?
Well, we can look at that in two ways. One is that the measure that was implemented by the Ministry of Health as well, the people adhering to those, it seems that it's showing a good results. That means that this is a combined effort between the public and the Ministry of Health, and I'm glad that things are okay. Of course, one of the most important things with this pandemic is that it's unpredictable. Of course, we can have, as you say, kind of sense of comfort, but we need to be very, very careful as what is going to happen this next week. But I'm optimistic that things are going to be under control.
Okay. Is this an indication that we may be successful in flattening our curve here in Belize?
We can say that, that so far we are being successful, and again, we need to applaud the public, because that means that everybody is listening and taking it as serious as we should.
Yeah. No, I think in moving around the city, I can tell you that people are staying home. They are paying attention to the protocols that are in place. Now, we can't drop the ball on this issue. We have to ensure that we're doing all we can to reduce the spread of the virus over time. Now, one of the things that happens is that we pay a lot of attention to international news and the information that comes out from international organizations like the World Health Organization, PAHO, CDC. And the most recent information that came out last week, as we learned more about the novel coronavirus, is that there are many more asymptomatic carriers circulating in populations than we first imagined. Can you explain to me what that means?
Well, as you know, and as we also learn every day, that the virus, it behaves different in country by country, as was mentioned the other day. As you see, even in the United States, you can see that the virus is being impacted in different ways to different cities, and it depends on several points. One, if we probably look to New York, it's a very dense city with subways, with different ways of transportation, that of course put the people to a different risk of exposure, different to other countries. I believe our country in a way, because we don't have this density of population, and that in a way it's helping us. Of course, the concern is those carriers of the virus that they don't exhibit symptoms. 80% of the population, as we know, are going to be asymptomatic. That means that they are not going to exhibit any fever, any cough, but they are carriers of the virus. And that's the importance that we stress to the population, that we need to wear masks when we are going outside, because that way we are protecting each other. No?
So explain, what happens is someone comes in contact with the virus and then they feel nothing. How do they transmit it if they're not symptomatic, if they're not coughing or dropping droplets everywhere?
Well, as we know, as we mentioned already, one of the things is that just the way of speaking, we will be able to disseminate the microparticles, no? Just the way to speaking. We don't necessarily need to cough. And that's the reason why the 6 feet, it became one of the rules, because we realized that it's not only of coughing, but just to speaking that we'll be able to transmit the microparticles, and that's the importance for us to adhere to the 6 feet. And also, in some cases that this is not easy to do, because we need to go to a market or pharmacy, and then sometimes we're in a meeting and we are unable to do that, then that's the importance for us to wear a mask.
Do we have an idea of more or less how long an individual can remain asymptomatic? Is it for the same period of time as though you're fully infected with COVID-19?
In average, it's going to be like that. I mean, we have 14 to 21 days that we need to be careful and observant. Of course, in the case of asymptomatic, and also if we don't know that we have the virus is a little bit more challenged. That's the problem. No? It's easy if we are tested. If I test today, I'm positive and I don't have any symptoms, and then after 7 days, if we don't exhibit any symptoms, in some countries they allow the people to go back to work with a mask all the time. Before entry the work, they need to take the temperature, take the temperature at midday, take the temperature at the end of the day, and then that is the rule for an additional week. But again, in cases that we know, but it's those that are in contact, those that we don't know is the main problem.
This is looking a bit forward. I'll ask you the question nonetheless. How do you see us returning to a sense of normalcy after the state of emergency period has elapsed? We'll go back to school, we'll go back to work, whatever the case may be. How do you envision that? Because COVID-19 isn't going to go away anytime soon, so there's still going to be that fear that it is among us somewhere.
Well, that's a very interesting question, because of course, how we are going to back to a new normal is going to be and strategize. We can't go back to normal suddenly. It needs to be done on a very step-by-step ways, in the sense that we can realize that at the moment when we're trying to back to normal, at the moment that we see an arise of new cases, we need to be able to back to lockdown again.
Wow, that's an interesting perspective. You know, Dr. Hidalgo, you are a member of the International Critical Care Society, and so you have the insight of what's taking place in other parts of the world. We were late in terms of the spread of the virus. We only confirmed our first case a month ago. What are some of the lessons that we can take from other countries that have been able to mitigate the spread, and some who have faced severe outbreaks?
That's a good question. Just this morning we have a Zoom meeting with the World Federation of Societies of Critical Care, and we were discussing the same thing. Why some of the countries probably they failed at the beginning, and what are the success of other countries, like South Korea is a good example. You know, they strategize, and how they strategize that the coronavirus. You know, of course, they have the ability to do a different way of testing, and also we have other countries that probably they didn't have the same experience. Like probably the example is Italy, that they start late, and then they have this amount of cases and deaths at the beginning. No?
Yeah.
I mean that, and in the other things also we were discussing what is going to happen with Africa and some countries that they have definitely their minimal resources. No? We are lucky in a way that we have certain capacity and access to equipment and things, but there are countries that they don't have that ability, no? And that we were discussing that how we're going to address and help those countries trying to educate and trying to essentially use minimal things to control that. And I believe the most important thing is in countries with a dense population is the wear of masks.
Yeah, yeah. And what about testing?
Well, testing is a challenge not only for us, it is a challenge everywhere. As you know, if right now, just to give you an example, if you want to buy a machine, a PCR machine, which is the standard and gold standard testing,
Yeah.
if you want, then you put your order, and they probably can provide you the machine, but in terms of testing, it's a quote by country. I mean, if you say, okay, I want to buy 2,000 kits, they will say, okay, we will dispense X amount of kits this month, and we will dispense it in a step-by-step way. They are not going to sell you the 2,000 kits because everything is based on quotes. Since at this point, PCR is the only gold standard, none of the rapid tests are validated for acute phases.
Now, can you, I mean, that's a very medical perspective in helping us understand. I know that the Belizean public, quite rightly, if they do their own research, they realize that countries that have seen less devastation from COVID-19 had more testing. But what are the barriers locally? So you talk about quota system, the PCR machine, which is a very, it's an actual equipment that you use in the labs, and that's how we're able to test locally.
Yes.
But is it practical for us to believe that that we as a country can move towards a mass testing protocol?
Well, it's something that they are discussing, you know, in the sense that probably you are going to see some areas that they will put some like tents that will be able to increase our ability to test. Okay. As far as I understand, we have enough kits right now for our population, and some more are coming. I believe the Ministry of Health is also looking on different strategies to increase the amount of testing that compared to what we're doing right now.
Essentially, testing has become a part of our new reality going forward as well, right? Because we will have to continuously be doing so, notwithstanding the flattening of the so-called curve, correct?
Exactly. We need to, at the same time we are observing the flattening of the curve. Also, there are many strategies that it needs to be done to ensure that we continue that way.
Yeah. Now, there's also of recent been some research out about the antibodies test. What's your perspective on that?
Well, you know, right now, just to give you an idea, if I test positive today with the PCR, the gold standard, and then I want to know what is happening, then in a month time, I can do a test that will essentially measure the memory, and it said that I've been infected with the virus, and now I'm cured, but I have a memory in the body that will tell me that I've been in contact with the virus, that I'm not active, but I've been in contact with the virus to test the antibodies.
Okay.
Is it to say then, and this is purely theoretical at this point, that perhaps once you've contracted COVID-19 before, that if you were to contract it a second time around, your body would be more prepared or adept at dealing with the virus?
Definitely, we will definitely immunity and we'll be able to fight the virus in a better way. That's what we are expecting for the future. That if that is something that is going to become seasonal, because that's some of that expectation that we have. It's nothing that we can conclude, but it's something that we are expecting that at some point it will become seasonal, and then all of us we will need to develop certain immunity to the virus, as well as the most important thing is developing the vaccine. But the vaccine, we were talking about probably 12 to 18 months looking ahead.
Yeah, and there's the development of the vaccine, and there's also access to the vaccine.
That is definitely two things.
Yeah. Now let's look at what we are seeing locally, and I know that you've had some experience with some patients so far. We have clearly been able to read information, see news stories and international coverage on just the range of how COVID-19 may affect people, and where preliminary the information coming out of China was that it would only severely affect elderly and those with predispositions or other conditions. We're seeing that different age ranges are affected. Some people require hospitalization but not intensive care. Talk to me about how it affects different people and what we have learned now 4 months after the discovery of the virus.
Yeah, well, every day we have new information, and also we have new things that we are discovering with this virus. As one of our colleagues was saying last week, at this point there are no experts in this virus. All of us are learning every day. I mean that every country is sharing their own experiences. And what you say is true. At the beginning, we was thinking that probably only the elderly people with certain medical background are going to be affected, but that changed. We're seeing right now that everybody at any age can be contracted the virus. Also, the range of symptoms and signs have been different. At the beginning, we was focusing only on the respiratory system that definitely is the most affected, but also we are seeing many other manifestations. We see some skin changes. We can see some neurological symptoms, respiratory symptoms. Also, since the virus, it creates an incredible and very disorganized inflammatory response in the body. Also, we are noticed that the body, it increases its ability to clot. And then we will see many patients with clottings, like pulmonary embolism. We see patients with ischemic stroke. That means that the clots are affecting the flow of blood to the brain. As many other symptoms, but those are the more relevant that we are noticing, and that also increase the rate of mortality.
Yeah. So the reason I asked that question is because where we have learned, and you're right, because they're even looking at how some people are in need of dialysis treatment after contracting COVID-19. Just the range of symptoms and complications they can have are so vast. So what does that mean for the preparedness here in Belize for our intensive care isolation unit? Because from what we've been told, it was primarily focused on the respiratory challenges that patients would potentially have.
I will tell you something that is a very encouraging, even that despite of our resources in the country, Dr. Arriaga and the team in Cal Kirchner, they start to prepare the COVID-19 unit several months ago. They was conducted training, even that we don't have patients, they were conducted training day by day in a different ways, training with equipment, training as how we are handling the patients, training as how to deal with mechanical ventilation. And also one of the things that we discussed at that point is that also we need to have the ability to dialyze patients in the COVID-19 unit. That is also one thing that we are able to do in case a patient he will develop acute kidney injury. Since I mentioned in some of the presentation before, it's a cascade of events that start with the entry of the virus in our respiratory system, And then after the respiratory system is being affected, then this cascade of inflammation is slowly, essentially take our patients to something that we call it a multi-organ failure, meaning that one of the most sensitive organs immediately is the kidneys. We can develop acute kidney injury immediately, after we start to develop multi-organ failure. We don't see any patients so far right now with acute kidney injury, but this is something that we expect in an acute ill patient.
Okay, so you're already prepared for that. That's what you're saying, or we are already prepared for that.
We are ready for that. Also, the COVID-19 unit also is the plan in the case, and again, we hope that is not the case. In the case of, for some reason, we can overwhelm, is also a plan of expansion immediately to other areas that are already prepared.
If we're looking at the healthcare system from a broad perspective, and you're talking about the possible impact of coronavirus on the kidneys as a result of perhaps an individual becoming afflicted with COVID-19, when we look at the fact that there has always been an urge or there's a clamor for dialysis machines and for treatment for kidney patients, is it that perhaps this area of the health sector can become overwhelmed? Is that a possibility that we're looking at persons who would have contracted COVID-19 and end up surviving it, but having overcome it means that they would now become kidney patients, so to speak?
No, we need to understand that acute kidney failure is different than a chronic kidney failure.
Okay.
In an acute kidney failure, we have a window of 3 weeks.
Okay.
I mean that when we discover that the patient have an acute kidney injury, we initially do something that we call it a fluid challenge to see if the kidneys are going to respond conservative. Of course, that is a very dynamic situation. It's nothing that we sleep on. We need to see what happens in the next 12, 24 hours. And if the kidneys are not responding, then we know that the patients will need something that we call it a kidney replacement therapy. That is basically they put the patients on a dialysis machine. And from that point, we will have a 3 weeks period where the kidneys can come back to normal. It could be any time between, sometimes the patient needs only 3 or 4 sessions and then the kidneys back to normal.
Yeah.
And but we can expand up to 3 weeks.
Okay, got it.
Now, when you talk about this level of care, I think there is a natural assumption that people have that once you're hospitalized for COVID-19, that this is the level of treatment that you may be receiving. In fact, in Belize, we have 2 patients that are hospitalized, but they're not on ventilation and they're not requiring this extreme level of care. Talk to us about the treatment that takes place in the hospital that is necessary for COVID-19 patients.
Yes, well, as we mentioned, 80% of patients are going to be asymptomatic. That means that they are not going to require any hospitalization as such. 20% of the patients and more or less 15% of the patients, it will develop a moderate illness that they will require support. That means that we will monitor, they will require IV fluids, they will require oxygen and continuous monitoring to prevent for these patients to go to a necessity of being on ventilation. And then that period it varies. Now we can the first initial phase could be just minimal and last 1 week. The second phase we see all these moderate symptoms, and in this second phase, at any point in time, the patients can go either ways. Either we can continue with the conservative treatment, but also the patient can go to a phase that we need to offer all this type of support.
Yes, yes. You know, and this would be why you'd have to identify your symptoms early rather than waiting until you're severely ill. Would you agree with that?
Totally agree. And as I say, one of the advice we usually say is, if you for the listener, is that if you start to develop any fever or cough, contact immediately the hotlines, and they will give you instructions as what to do and also as how to be able to be tested. because it's important to recognize the condition earlier rather than you became very complicated and ended in an ICU.
Yeah. So Dr. Hidalgo, this brings one final issue to the forefront, and I got to say that we have some very brave persons in this country that did test positive for COVID-19 and have disclosed their identity and spoken up about challenges with stigma. Many experts have likened the stigma to COVID-19 as to what we saw with HIV back in the 80s, and just if we continue to stigmatize patients and become so almost obsessed with working out their details publicly, that it can have an adverse effect on people accessing healthcare early.
Exactly, and that's also is an important point that you mentioned, because people became afraid to go on testing, you know, and then they will be at home thinking that if they go public, it will create a stigma and discrimination. But also, I want to mention something. In some countries, either the healthcare workers that are in the front line, they are being discriminated, and in some countries, even if you live in an apartment complex, the people that live in the apartment complex are not allowing the doctors to go into the apartments, as well as nurses. I mean that this thing of stigma and discrimination is not only for the patient but also for the healthcare workers. I'm glad that the population of Belize is being very supportive to the frontline workers, and I'm applaud that the Belize population is being essentially very supportive. As you see, some people are sending different type of food or donation to the people that are in the front line, and I think so we need to do that and continue fighting the stigma and discrimination.
And just lastly, while we all sit at home and jump on the internet and demand for testing and all the other precautions that we think is necessary, we can't forget our own individual responsibilities.
That is important. Again, coronavirus is a social responsibility, and we need to be aware and also to be protected from each other, and that's why we need to adhere to all these different measures that it seems to be difficult sometimes, but it's the time we're living. We're living in challenging times. It's not only Belize, it's everybody in the world, but I think so we are living in a very blessed country. We have a population that glad that adhering to all the measures, and we are doing good, and we can do better. But don't take this for granted. The COVID-19 is serious, and hopefully we continue doing the way we are.
Well, thank you so much for talking with us this morning, helping us to make sense of all the information that is out there. We appreciate it, and take care. Stay safe.
Thank you. Same to you. Have a nice day.
All right. There you have it. That was Dr. Jorge Hidalgo talking about the latest with COVID-19, just looking at the data and the research that that is being uncovered as the world learns and tries to understand this virus better. But with that, we're going to go ahead and take a break. And when we come back, we're going to be hearing from urban planner Carolyn Trench Sandiford. And she has a couple of points looking from an urban planning perspective as to what we need to be looking at this phase of the pandemic. So that's coming up after the break.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.